This is an important topic. What effect has COVID-19 had with people who have existing mental health or addiction issues? Dr. Amber Mackey is joining us now. She is from Ogden Regional Medical Center. She's in our ABC4 backyard. Dr. Mackey, thank you for being here. What are you hearing from your patients?
Yeah, Nisha, thank you for having me on. We are seeing a lot of people struggle in a multitude of ways from coronavirus, people with existing mental health and addiction issues, but also people that have really not struggled with those before. Really affecting people from financial strain to being isolated at home, not being able to do their normal self-care routine. So it's really taking a toll on everybody in our society.
So many people are dealing with this. I know Katy Perry even posting this week, am I more afraid of catching COVID or the depression symptoms that I seem to be going through? What are people telling you? What are they feeling? Is it a lot of stress, or is it the blues, or is it more than that?
It's a little bit of both, and it's more than that sometimes. So people are very anxious. They're wondering about paying bills, what's going to happen with my job. They're trying to have their kids homeschooled. They're stuck at home. So there's depression with that, like isolated from people, and so they're really struggling with both. And then sometimes it can get a little more than that. And actually having feelings of hopelessness and things like that. So
if you are dealing with any of those symptoms, what can you do for yourself? Or if you know your loved one is going through that, what can you do to help them?
It's a great question. I think one of the most important things is to try and stay connected. It's really easy to get disconnected from everyone right now. Most people, they're not seeing the people they normally do, even just going to activities or church or any of those group settings. So really reaching out to the people in your life and making sure that everybody has someone that they can talk to and lean on. And then also trying to make some kind of consistent schedule for yourself. If you're stuck at home, get up, get dressed like you would to go to work, and really try to keep some level of normalcy and finding some time to take care of yourself during the day.
It's so true. Just shower.
Yeah,
you can do it.
It's true. It makes a big difference. It really does.
How do you know when you need medical help, when it's just to the point that you should really see someone?
Right. That also a great question. We think about going to get help a lot of times when things have gotten really bad, like we are having suicidal thoughts or something like that. But really, if it's affecting your life, if you're having difficulties sleeping, if your relationships are being affected, you're not working as well as you normally would, it's time to get help. And there's a lot of different ways to get help, from doctor to therapist, or even just reaching out to friends and telling them, hey, I need extra support right now.
How can Ogden Regional help our viewers if they do need that?
So we offer, at Ogden Regional, and actually area MountainStar hospitals, including St. Mark's in Salt Lake City and Lakeview and Bountiful, we all have inpatient psychiatric hospitals that can give people a place to come if they're in an acute crisis. And we have doctors and therapists there to help them. At Ogden Regional, we also have an addiction treatment center. Right now, substance abuse is definitely high and adds stress. People are drinking more or using substances trying to deal with things. And we have inpatient, outpatient, lots of different programs to meet all different needs.
For more information, everybody, we'll put the website on your screen so you can get that. There's MountainStar Healthcare right there, MountainStar.com. ABC4.com/midday will make it easy and link you. Dr. Amber Mackey joining us this morning with that important information. Thank you for being here.
Thank you so much for having me.
Brian, over to you.